Welcome back, everyone, to the Mental Health Evolution podcast, where we are talking about how the landscape is quickly evolving in the mental health industry. Today, we are joined by Dr. Linda Michaels, a psychologist in private practice in Chicago and co founder of the Psychotherapy Action Network, or PsiAN. Dr. Michaels brings a background that spans clinical practice, psychoanalytic training, and organizational consulting, along with experience advising organizations on strategy and systems level change. Through PsiAN, work focuses on how psychotherapy is being shaped by post pandemic shifts, the rise of digital mental health tools, and the growing influence of corporate and platform based models in the field. So, as always, for our listeners, we like to highlight a few articles before we start talking to our guest. And these will all be in the show notes if you hear something of interest that you want to dig into a little bit more. So, the first article here is called They Thought They Were Doing Good, but It Made People Worse: Why Mental Health Apps Are Under Scrutiny. And this article by The Guardian examines the rapid expansion of mental health apps after the pandemic when demand for care surged and services quickly shifted online. It raises concerns that while these tools expanded access, they also introduce questions about quality, safety, and the growing influence of commercial incentives in mental health care. The next article I want to highlight is called Chatbots and AI Therapy Are Filling Gaps in Mental Health Care, but Regulation is Lagging. And this is from the Washington Post. We've also definitely had some podcasts about regulation, so feel free to check those out as well. But this article explores the increasing use of AI driven tools to address gaps in mental health care access. It highlights both the appeal of these technologies in a strained system and the concerns about oversight, clinical validity, and whether regulation is keeping pace with the adoption of these tools. And then lastly, the third article I want to talk about is actually from the group that our guest represents today. This report is from PsiAN and it's called Practice Management Companies: What Therapists Need to Know. And in this report, PsiAN looks at the rise of practice management companies that support therapists with billing, scheduling, insurance navigation, and other administrative functions. You might have heard us refer to them as MSOs, or managed service organizations, on this pod. It also highlights concerns from clinicians about transparency, autonomy, and how these platforms may be changing the structure of private practice and psychotherapy delivery. So, without further ado, I would like to say thank you so much, Dr. Michaels, for joining us today.
Well, thanks, Rachel. So glad to be here.
So, let's dive in. I am really curious about the Psychotherapy Action Network, or PsiAN, and kind of how you got started and what it's all about.
Mhm. Yeah, we got started in 2017. And what it's all about basically is providing a voice for psychotherapists and highlighting what are some of the key issues in people accessing quality, effective psychotherapy, and
Mm.
it also in empowering and supporting the clinicians who provide that care. So we started off, like I said, in 2017. And as you mentioned in your opening notes, that was certainly a time leading pre-pandemic, but still a
Mm.
time of great need for psychotherapy. People were more and more open to seeking help. Stigma's been going down. It's good. People really, though, were confused about how do I find a good therapist? What steps do I
Mhm.
take? How do I pay for it? What do I do? At a time of increasing need, there was actually a lot of limitations and reduction in the field itself. What do I mean by that? More and more grad schools were just mainly teaching the family of CBT therapies. More and more
Mm.
research dollars were going into that same area. Professional guidelines were coming out there are many ways to help people, and we were really only teaching and studying and researching kind of one family of therapies. And it was just such a mismatch between what we should have been doing as a field, which is making more people more aware of the diversity of tools and types of therapies that are available so they could find the one that might help them the
Mm,
best.
great. And then how has that sort of evolved over time? I know that the pandemic has really changed everything, I would say, in our field. In some ways, really great that so many people reached out for care during that time. Also, that we were able to do telehealth and still help people that way. But it certainly has been a spotlight, I would say, on the field, and I think has led to a lot of the evolution of things we're seeing, like tech companies and MSOs or private management companies, all kinds of AI chatbots that are acting as therapists. All of these things, I think, evolved out of so many people taking a good look at our kind of quiet, if you will, little industry over here and thinking, ooh, how could we add things to that?
Yeah, I mean, I think over time, what we have seen at Action Network is, starting off, there's so much confusion, like I was saying about, I mean, the 400 therapy brands and what
Mm,
does evidence base actually mean and how has that phrase been misused and if not co-opted and all the different ways the insurance industry has been so problematic in failing to provide parity coverage for mental health. But yes, now with the pandemic and even post-pandemic, the introduction of these totally new stakeholders like private equity investors, venture capital investors, big tech, Google, Amazon, joining with the insurance industry. I mean, all of this is really unprecedented in our field. And so we are looking into all of that and again, trying to stay true to how do we promote access to effective psychotherapy and how do we support the clinicians who provide that care, and
mhm.
now how do we cut through all of this clutter to really continue to do that in our mission.
Yeah. And so, what are some of the examples of ways that you do support both therapists and people looking for care?
Yeah, I mean, one of the main things if we think about the public, we have done several large nationwide market research studies with the general public, and these are with over 3,000 individuals, representative of the U.S. population, weighted to be just a mirror of the U.S. population demographically. And we really wanted to bring in the voice of the public into all of this and not just be talking amongst ourselves as professionals about what is therapy or how should it be done, but what do people want from us? What do people
Mm,
want from therapy? How do they find therapy? What stops them from seeking out or finding effective psychotherapy? So, from our two large quantitative research studies, we really learned a great deal that had not been asked before. And that kind of draws on my previous career in the business world, doing a lot of big market research studies for major corporations. But we found that people really want, of course, they want a safe space. They want a therapist who's non judgmental, all of that good stuff. But they really understand therapy is going to take some time. It's going to take some time to understand their issues and unravel them. And they really look at therapy as a way to invest in themselves and their future. It's not a drag. It's not, they're worried about how they're going to afford it, of course, but
mhm.
they really also want a therapy that goes beyond symptom management and really helps get to the root of their issues.
Yeah,
So they know there's something deeper and they want to go deeper and they want to figure that out.
that's great. I love that. And then how are you supporting therapists in providing that or in the everyday work that they do?
Yeah, we've done a lot. I mean, we have written a lot. We have published articles. We have a book. We've done other research, which I think we'll talk about in a minute, with therapists on the practice management companies. We have a really active policy team that is looking,
Mm,
scanning the landscape and what do
mm,
we need to be working on. Have a lot of position papers. We've done a lot of petitions to say, practice guidelines have to incorporate all the evidence, not just a part of the evidence. The World Health Organization needs to have a psychotherapy manual that includes all the psychotherapies that are evidence-based, not only a subset. And so I think across all of our petitions, we've had like over 120,000 signatures and gotten some supported different legislation and things like that. So we're really trying to do a lot, again, not to teach people how to do therapy. That's why they went to grad school and have their consultation groups and consultants, but rather how to function in this world, looking at the bigger picture, the bigger systems that in which, we're all trying to function and run our practices.
I love that conceptualization because I think what I find most often when I talk to either practice owners or individual therapists operating right now, they're so good at looking internally, right? Especially at the care of their clients. And then beyond that, a lot of them have taken the look at their own business structure and how they're running things. And that feels like a big step, but very few, it's a much smaller number, are looking at what's happening around us in the industry.
Mhm.
And I think for a long time, I've been in this field since 98, and we didn't really have to. It didn't seem like think about that. I mean, maybe we should have then too, but now there are so many players and so many things happening every single day, legislation wise, consolidation wise. There are just big things happening, and we have to. So it's a lot of things to be paying attention to, which is why I love that your organization helps sort of distill information and do petitions and help people know where they might best get support or support things that are happening.
Yeah. Yeah, absolutely. And we've had a lot of, pushback and information sharing about apps and chatbots and things like that, the digital mental health tools, if you will. So much so that, a big part of our history, which was terrifying at the time, but now I feel proud of, is that we were actually sued by Talkspace for
Wow.
one of our letters our letters of concern that we wrote to. I'm a psychologist. We wrote it to the American Psychological Association, and Talkspace promptly sued us for defamation and libel and $40 million in damages, which, like I said, was absolutely a terrifying and harrowing experience to go through. But the
Right.
lawyer who represented us did so pro bono because she clearly saw this as a First
Mm,
Amendment free speech issue and as an example of a big company trying to bully us into silence.
mm.
So, you have to ruffle some feathers, I guess, and along the way, but we definitely got the attention of Talkspace, and we've spoken out and petitioned the FTC against BetterHelp as well. And so, I mean, there is definitely a lot that we can do, and we must.
Wow, that's inspiring because I think that it's easy, like one of the things that I see when I look across all the different disciplines with therapists is we don't have a whole lot of unifying bodies in this particular advocacy, right? We have the APA, we have the NASW, and those are certainly great. But this seems like a time when we all need some unifying advocacy.
Yeah, and that actually from the very beginning was one of our pillars is that we welcome all disciplines, people with all degrees, all theoretical orientations. We want to bring people together and break through those silos because having those silos where we only talk to people who have the same orientation or degree as we
Mm.
do, that's how we limit our own power. And so really cutting across those silos and artificial barriers and really bringing together the energy of the professions is, I think, a key part of our strength. And I think that's why we have nearly 7,000 members, individuals, and about 95 organizational members. So we're really trying to build that collective voice and source of support.
I love that. And for our listeners, if that's something that's of interest to you, we will certainly include ways to get involved with this organization in the show notes as well. But I want to take a few minutes to dive into this article specifically about practice management companies. How would you describe these companies in plain language, and what is it that you think is most important to note about this article?
Yeah, I mean, in plain language, what these companies are is they are a middleman that sit in between the therapist and the insurance company. So they take a cut for doing so, and they get paid by the insurance company. And they really function like a group practice, except at a humongous scale. Some people call them
Mhm.
mega group practices, but they purport to offer a number of the benefits that you would get if you join a group practice. However, in our research, we found that really they only offer a sliver of those benefits. I mean, the reasons a lot of therapists join a group practice is for marketing support, for colleagues, for their own health insurance
Mm.
benefits. And while these mega groups do offer marketing support, I mean, they don't offer the colleagueship, you don't get benefits. You do become a 1099 contractor to these companies, and they
Mm.
do your billing. They will credential you with the insurance company at the beginning. They'll do the billing, and they do offer some attractive things like a payment every couple of weeks on a regular payment schedule. So you're not
Mm.
waiting, like, when is the insurance company going to pay me for these sessions I already did? And they also, as part of their value proposition and their marketing materials, say, if you join us, you will make more money because we represent tens of thousands of therapists and we can negotiate a better deal with you for you with the insurance company than you can get on your own. Well, in our research, which, these were becoming very popular and we wanted to do some research and hear what actual therapist experiences were with these companies. In our research study, surveying nearly 700 therapists, we found that well, you have a 50-50 chance of actually making more money.
Mm.
50% of the therapists said, yep, I am making more, but 50% actually said, no, I'm not. I'm making the same, or a third said I'm actually making less. So there are really a lot of trade-offs as well. Like I
Mm.
said, you become a 1099 contractor to this entity. They hold all of the patient data. So if you ever leave, you have to recredential and recreate all of that data yourself. And then I think, one of the big things is that there's really virtually no transparency on who actually owns these companies. Who are you actually
Mhm.
becoming a contractor to? And we asked, if you knew that these companies had major ownership or investment stakes by the insurance companies, would you work with them? And 85% of the therapists said no. I mean, we're trying to find ways to limit our exposure to insurance companies. But in fact, all of these practice management companies have major ownership or investment stakes by insurance companies, United, Blue Cross, Cigna. So, and that is not made clear to therapists. So I think there's a real difference in terms of what their marketing message is and then what the
Mm.
realities are.
Yeah, exactly. I mean, that was something that really stood out to me in the article as well, is knowing that 70 or 60% or whatever of these companies is owned specifically by the insurance company. They're kind of paying themselves then, right?
Yeah, and the percentage is actually a lot higher than that. It's virtually all of them. And yes, the insurance company, every time you do a therapy session, the insurance company is paying itself as an owner or a major investor in these practice management companies. And then, of course, there's a lot of data privacy concerns. Headway right now is being sued in a class action for sharing data with Google. And
Mhm.
just conveniently, just so happens, Google is one of the owners of Headway, so that made it very easy for Headway to share data with Google. And now there's the whole kind of AI scribe function or feature that these companies are marketing where, using AI tools or recording entire therapy sessions to create a transcript and then produce a documentation, a note or progress report or treatment plan or something like that using AI tools. And then if you dig way down deep into the terms of service, you see, yep, all they say all of our AI stuff is handled. We outsource that to a third-party AI company, and we trust them to keep it de-identified and anonymous and at arm's length and all that stuff. But we've heard so many times, we've learned the lesson that data can be re-identified and, it's
Mhm.
not all that safe, but the companies are really trying to keep that at an arm's length. A recent article, I should say, also shows that, Talkspace, for example, is mining all of the text transcripts it has between clients and therapists to train and create its own LLM, its own
Yeah, I read
proprietary.
that.
Yeah.
Mhm.
So, I think this is just the wave of the future with all of this material that clinicians are making available to these practice management companies will be used by those practice management companies to ultimately create AI LLMs or chatbots to try to substitute for human therapists.
Yeah, and just to be clear, large language models is what you're talking about with LLMs.
Yes, yes, those are my personal initials, LLM, but that's not what I'm talking about.
You wanna tell us something about yourself? Am I talking to a person or not? Well, that is all such good information and so much to process. We are about out of time for this episode, but I would love it if you have something that you think is really important to leave with our listeners, whether they be businesses in the industry, therapists themselves, or clients seeking care.
Yeah. I will say on the client side, to keep looking for a therapist who will provide you the kind of therapy and the kind of relationship that feels like a good fit, a good trusting fit for you. It's out there. You can find it. And we are actually launching some tools to help people do that, a nationwide directory of clinics. And then I will say for the therapists out there to remember, any business decision that you take for your practice at heart is really a clinical one. And to take as much
Mhm.
care and consideration and thought in how you do your billing or all those kinds of things as you do with any decision you're making in treating your patients. And that
Mm.
we're never going to have the money or the deep pockets or the lobbyists or whatever that all these corporations have, but we have the knowledge, the care, the training, the standards of our profession, and that should guide us. It means a lot. And we also really have to stick together because we're not going to have those deep pockets, but we do have all that other good stuff. And we have to stick together and push back to protect and advance our profession.
Wow, I love that. On that note, Dr. Michaels, thank you so much for being here. Thank you for the advocacy work that you're doing. And we will definitely provide opportunities for people to connect with you if they're interested in the show notes.
Well, thank you so much. And you are doing your personal advocacy and creating this pod and making it available to everyone. So I really commend you for that and really appreciate your efforts.
Thank you. To our listeners, we will be back next week with more relevant issues in the mental health industry. Bye for now.